Hey loves, this is Yawande, aka Wande, aka Wande Love, aka La Petite PA, and I'm here to kind of share with you how my first week in internal medicine went.
I cannot wait no longer. Give me my superpower. Give me all of your hours. Let me unleash my babe.
Today marks my, complete first week in internal medicine. So I worked 3 12-night shifts. And I just want to let you know kind of like how day 1, 2, and 3 went. So for day 1, I started on a Tuesday, so I was off on Monday, and I have a classmate that is on this site with me, but we have different shifts. But this day, she actually started on a Monday, and my Tuesday, which was my first day, was her second day. And so we met up because she's been here before, like volunteering. Met her in the lobby. We took a picture for our visitor pass because our badge is not yet ready. And we went up to the floor that we were going to be on. So there is an ICU and an IMC. So ICU, that's for the more critically ill patients, the intensive care unit. And then also IMC, I think is internal medicine something. I don't know what the C stands for. But basically this is our internal medicine rotation, even though we're working in the ICU. So my first day was kind of like, I really didn't know what our role as PA students was going to be, like where we fit in, because you know they had the nurses that had the patients that they were managing. They had the respiratory therapists that were obviously in charge of the mechanical equipment, the vents and stuff like that. And then we have the PACs, the certified physician assistants, and nurse practitioners, and medical doctors, MDs, and I think there was a DO as well. We just sat in the provider room, kind of just like waiting to see how things would go. And so I was kind of like following or observing or shadowing. But yeah, so I was observing one of the PAs I was with. She was preparing for like rounds, I guess, to give report on her patients. She had about 6 patients that were assigned to her. So she went in and checked in on them. I came in for the shift that was 8 a.m., the 8 a.m. shift. So she went in just to check up on how they were doing. There was already, you know, a progress note or whatever written for these patients because it's the ICU. This is not usually day 1 that they've been here, or if it's day 1, they'll probably be there for day 2. So there was a patient who was wheezing, because you know when you're doing PA school virtually, and I mean for the last 2 months of didactic we did do some in-person stuff, but like for the most part we can't really listen to like something that was like pathological, something that was wrong, I guess, because most of us are young and healthy. So I've heard normal lungs, but this is the first time I got to hear like wheezing and what wheezing sounds like. So that was cool that I got to hear that. She checked the neuro status of a patient who I believe, this is the patient, they had high-grade stenosis in the past, and he was presenting for something else, but like she wanted to check his neuro, like he knew where he was, he knew his name. All cranial nerves, like 2 to 12, were intact. Everything was pretty much normal, but he had a right facial droop. So I see there's a lot of language that I'm still trying to like get familiar with. For the most part, everyone is on levo, which is a type of which is epinephrine, which is going to increase your heart rate, which is what they usually give to patients who are like septic, you know, if they're hypotensive and they're just trying to get their, you know, blood circulation back in order. They give levo for a lot of things in the ICU. That was that. I came in nervous, you all. I was very nervous because I didn't know what to expect. And like, you know, I hear all these things about like when you go on rotations, they're gonna pimp you, which basically means they're gonna like, you know, ask you questions on the spot. And you know, no one pimped me on my first day. I would say day 2 was a little more I don't want to say exciting, but more interesting for me. It was exciting because I got to do some things I haven't done before. As I was able to assist in a line of placement, basically an IV in your jugular vein. And yeah, it was really cool. They asked me, does blood make me like queasy or pass out? I was like, no. I've never fainted in the sight of blood. Well, first you want to lidocaine. So you get the lidocaine, you pull it out, and the needle, you numb the area. You tell the patient you're gonna feel a pinch. You numb up the area so they don't feel you actually making an incision in their neck and sticking a guide wire in their neck so that you can put in a catheter. You all, it's wild. I saw an NG placement because the nurse was having difficulty putting it in, so my PA went in to do that. Okay, we were going to do a paracentesis. Okay, so I was, I guess, kind of pimped, but like it doesn't even feel like pimping because the way it was asked, I didn't feel intimidated. You know, I think the preceptor that I was with yesterday and today, he's pretty cool. I don't feel like quite intimidated by him. He's so knowledgeable. He knows so much stuff. Like, he's so knowledgeable, and you know, I'm excited to know all that kind of information one day. I'm not sure if I'll work in the ICU, but you know. Today my preceptor didn't want me to puncture a lung, but I watched a thoracentesis, which is removing the fusion from the lung. So that was cool. There was a lot of fluid that came out of like my patient's lung. He had CHF, like congestive chest failure, congestive heart failure. My preceptor also, after our shift yesterday, he asked me like, you know, what is going to be tested on the internal medicine internal medicine EOR, and I showed him, you know, this percent is cardio, there's gonna be cardiopulmonology, endocrine, musculoskeletal. Then he basically gave me like a quick, maybe like 25-minute lecture on certain things like angina, cardiomyopathy, congestive heart failure, arrhythmia. So today he was like, do you have any more questions? I was like, no, not really right now, but I do have a lot of studying to do this weekend, so I'm pretty sure I'll have some questions for you this coming week. Listen, each health profession is just as important as the next, okay? Everyone has their own set of expertise because there's not one person that knows everything. That's why you need a respiratory therapist. That's why you need a nurse. That's why you need a doctor. That's why you need a physician assistant. That's why you need a social worker. That's why you need all these professions, okay? I don't know, I just started ranting. But yeah, that's how my first week went. But ta-ta for now. See you in the next video.